I'm Swapna from TheHealthSite.com. As part of our ongoing series of videos that we're doing for breast cancer awareness, I'm going to be talking to Dr. Anuradha Murthy, who's a senior surgical pathologist and who's been in this field for 30 years. So I want to ask you about when a sample comes to you for testing. Say a person suspects or a doctor suspects that the patient has breast cancer. What are some of the tests that you conduct, and are they part of standard tests across all over India, or is there something different that a patient can go for?
It's a very basic question and a very basic answer. We sort of communicate with the person who sends us the material, and we would solicit a very detailed history, if possible, along with the sample. Specimen has to be labeled, it has to belong to the patient, it has to be safe, it has to be well handled in the laboratory, and then post all this, a surgical pathology slide is prepared, which is then read, and we become the analysts at that point. So this is post-analytic, and if it is a straightforward malignancy, we then offer to the patient biomarker testing on the sample. Okay. The sample can be a needle biopsy, it can be an excision biopsy, it can be a mastectomy. So these are what we receive as routine surgical pathologists.
Are these tests standard across India, across all labs, or are there variations in different labs? Can a pathologist take a call about malignancy and say another pathologist might find it not malignant? Does that happen at all?
Well, it does happen. It happens less and less. In most good laboratories today, and most patients today have the options and choices of second opinions, right, of expert opinions, and they usually have a fairly safe outcome. A good laboratory is where the systems are in process, where they have accreditation, where there's NABL, CAP, and ongoing quality checks that are quality participation, quality controls. Right. These help a lot.
Okay, so
and
these are
audited laboratories.
Okay, so once a patient or the surgeon knows that the lab is qualified lab and a certified lab, then when you have to send the sample to say another lab, do most labs freely do that? Does the patient can the patient just say that I need my sample back and choose to go in for a second opinion to another lab?
Yes and no. The patient actually has full authority over his tissue, but we have to also follow audit processes. So we prepare our own sets of slides, keep reference material, keep representative material. And the most important thing is the patient should not divide his material prima facie. Okay. So he should not split material, he should not give it to two laboratories in the first instance. Right. But he can certainly solicit a second opinion after the primary diagnosis is made.
What are some of these biomarker tests that are recommended, and how effective are they, as a tool for the patient, for the doctor to determine the patient's, treatment roadmap?
Now, biomarkers are done and performed by the pathologist when he usually sees invasive carcinomas. And the pattern then is further subclassified by a set of 3 markers, ER, PR, and HER2 in the first instance. And now we add on a Ki67, which is another proliferative marker.
So for the users who are not familiar with these terms, could you simplify and let us know what is it that they can expect from their test? Is it something, is the report going to be easily read by them and understood by them, or will they need a surgeon to interpret it for them?
They should be able to look at these reports and logically conclude the type of options, because most surgeons discuss all the treatment options with their patients. At every level there's concern, and the relatives are actually quite alert. The patients themselves are very alert. There are many choices, and they're presented options very clearly. So they know what they're going in for, whether it is just a wide local excision, whether it's a mastectomy. So once they get the report with the new versions of a lot of Dr. Google going on, I think most patients are able to interpret their results. But of course, a doctor will always be a little more aware, detailed, and one must not, imagine more than necessary. So many of these tests are very, very complicated, and good laboratories have developed profiles. So they know exactly when to reflex a test, when a test is sensitive or equivocal, borderline.
Are these kind of tests available only in the cities in India, or do patients from rural areas and B and C towns also able to avail of these kind of testing procedures?
Unfortunately, no, because these tests are very critical. They're very difficult to establish, and there must be a high volume. But they can be managed clinically in their place of origin, and then they can be farmed out to good sender,
to different labs, as in
that, yes, who provide this.
Okay, so if you are going in for treatment for testing at a local lab, the local lab will then send it to these big labs for testing.
Absolutely.
And how expensive or affordable are any of these tests for a regular Indian woman?
I think they're affordable because they do definitely help in planning the treatment. They are a little expensive, but they're not outlandishly expensive.
Like how much would a test like that cost?
Within 4,500 to get the minimal data sets.
Okay, so post surgery, when how important is it to analyze the sample? If there is a mastectomy, then what is it that you are looking for in that? Because patients are often concerned about whether they're going to be in remission, or whether this will relapse and they will continue to need treatment.
Definitely examination of the lymph nodes, examination of the margins, examination of the involvement of the cutaneous tissues, the nipple. These definitely have a prognostic significance.
What about the staging? Is it done at this stage, or is it done prior to surgery?
Staging is done if it is a needle biopsy. And if we get the mastectomy, we anyway offer it to them.
Okay, so post surgery, when how important is it to analyze the sample? If there is a mastectomy, then what is it that you are looking for in that? Because patients are often concerned about whether they're going to be in remission, or whether this will relapse and they will continue to need treatment.
Definitely examination of the lymph nodes, examination of the margins, examination of the involvement of the cutaneous tissues, the nipple. These definitely have a prognostic significance.
Also, doctor, these days one is hearing a lot about BRCA1, BRCA2 kind of testing, and going in for a double mastectomy, thanks to Angelina Jolie making it really popular. Do we do that kind of testing in India? How many people are there who want or need such kind of testing over here?
Every woman who has a breast cancer is usually very detailedly kind of counseled. So her physician will ask her, has there been a history of breast cancer in the family? Has there been male breast cancer in the family? What would be the sort of family tree? And as a pathologist, there has been a lot of change in the way we've approached morphology. because we have now, from just a diagnosis, just a subclassification kind of a scenario. But I think every patient who is a case of breast cancer should actually analyze how many such cases have occurred in her family, whether her grandmother, mother, sister, or depending on the presentation, if it's unilateral, multicentric, bilateral, then definitely there are certain tips that allow the pathologist to maybe even consider that this could be some kind of a genetic familial illness. Now this BRCA itself is very interesting because BRCA1 and BRCA2, they are reparative, and when mutations occur, that is when the disorder starts manifesting. So these are not to be done without a proper genetic counselor, without a proper understanding. They're very expensive tests. So these require a lot of input financially. You need to go to a very specialized lab, and you should not take these tests lightly. Okay. So they should not be hyped too much, unless indicated.
Doctor, when it comes to surgery, many women are concerned about conserving more of the breast tissue. So what is the role of a pathologist during surgery in helping women, or helping the surgeon take that call?
Absolutely. The pathologist today is actually, frozen sections were somewhat a very, a sort of to give the diagnosis. Today again, the role of the pathologist has changed over these many years, from making a diagnosis of cancer when mastectomies were carried out, to now these very careful breast conserving procedures along with cosmetology. So a surgeon wants to know whether he has actually got clear margins. And that is now where the pathologist has become very, very important in assessing margins. And occasionally there have been instances when, although the margins they're very close, they can sometimes, that the tumor can still sit on a margin. Okay. Then the surgeon can go a little wider. Okay.
So you are you are there during the surgery when the patient is on table, and you help the surgeon take the call on how much to actually...
We sit in the laboratory, or we sit in the room outside, and we have a machine called a frozen section machine, and assess each of the margins that are separately submitted by the surgeon, and then inform them as to whether the margins are clear or the cut margins include tumor, so that the surgeon can go a little wider in one set.
Doctor, after surgery, chemo and radiation, if there is a recurrence of a lump or any other issue, and a sample is sent to you, then what are some of the tests that you need to do at that time?
Recurrences are interesting because we have to first confirm that whatever lesion we've got is not a second malignancy, it's the same malignancy. And if it is a relapse of the breast cancer, it becomes necessary to retest all the biomarkers, because the tumor itself, breast cancer, is very heterogeneous. So from one part of the tumor to the next part of the tumor, there can be a lot of variation. And these few cells, they can become renegade cells, and they can express different tumor markers or different biomarkers. So it becomes very necessary for every recurrence to retest.
So you have to treat it pretty much like a new sample?
Like a new sample. And if we have treatment options, because every other month so many trials are going on, and the patient can be given the option of another drug that may work. And very often there's a lot of like very much like antibiotics, the chemotherapy also stops working. So there's a sort of
you develop
resistance.
a kind of resistance. Okay, also, not many people are aware that breast cancer can happen in men. So, when you get a breast cancer tissue or sample from men, how different is it? How different is the cancer? Is it just like how it occurs in women, or does it behave differently?
It's much more rare. It's in fact sporadic, but then it does bring in a lot of the genetic marker systems. The patterns are very similar, and they also often express the same strong ER positivity. Okay. So they behave in a kind of a similar fashion. Okay. So, and then you have to elicit histories of prostatic carcinomas. We don't normally do screening and mammography
for men. Yeah.
For men,
okay. But so the detection happens at the time of with the biopsy, when there's a palpable
mass.
So that is not usually early detection.
No, no, it's a mass.
Yeah, and at that point in time, what is what is the option available to them? Are there enough labs in India that conduct tests?
Yes, it's to handle pretty much the same. Yeah, so the breast cancer in men, the only thing I would say is that they're usually associated with BRCA mutations. Okay. So it may be a good thing to offer BRCA testing in male breast cancers.
Thank you, doctor, for speaking to us about all these tests. And if you have any doubts about some of the terms that Dr. Anuradha used, don't forget to check the links below in the description. And don't forget to like this video, subscribe to more such videos, and share this with all the people you know who are suffering from breast cancer and who have all these doubts. Thank you for watching.